Hello, good morning, everyone. This is Gloria Zayans. I'm the technology guru with the Innovation Learning Network. Along with my co-host today, Jules Lancy, who is the biomedical engineer at Radboud UMC Reshape Center for Innovation. We are very excited to share today's Exponential Tech Tuesday, autonomous transport. From self-driving cars to drones, the possibilities are endless. But first, before we start, there are a few housekeeping items. First, you have been muted upon entry to avoid background noises and disruptions. If you are joining us by phone only and wish to chime in during the Q&A, please press *6 to take yourself off mute. We will hold off on Q&A until the end, where Jules will moderate the conversations. However, feel free to use the chat box during the presentation for questions and comments, and make sure that you select everyone from the drop-down menu. There will be several of us keeping track of the conversation and the questions. And last, this presentation is a contribution to the ILN, which means that you can live tweet throughout, and we will drop the session's social media handles and hashtags in the chat box shortly. Now I would like to introduce our presenters this morning. We have Brian Birch, Global Innovation Lab Manager, who will give us an overview of autonomous transport and its application in healthcare, followed by Janick Mischler of Swiss Post, who will dive deep into healthcare use cases and examples. We will then wrap up with Juan Bergelund of UAV Peru, who will be representing the emerging tech innovator in this space. So with that, I'm going to hand the session over to Brian to take us away. Brian?
And I'm going to share my screen. So first question, can everybody see the screen?
Yes, we can.
Great. So give you a little bit of background. So I've had both insurance background and healthcare background. So part of what I'm going to do is go into setting the stage. From the insurance perspective, we've been looking at a lot of autonomous cars because we feel that it's actually going to change the way people live and the way that they do things. So we spent a lot of time doing some research there. From my past life at Kaiser Permanente, I've also taken a look at how might it affect healthcare. So we'll go the quick 10 minutes. I want to set the stage first, because not everybody is as familiar with autonomous cars as I am. So just setting the stage, there's an estimate that 10 million autonomous vehicles will be on the road by 2020. But what does that really mean? So there's a couple levels of autonomous cars. So we've got driver assistance. So that's some of the active controls. We're not really worrying about that one. That happens now. We've got the partial automation, and then we've got conditional automation. The ones that I think we're really looking at in the future are what we would say are level 4. And level 4 is fairly high automation. The vehicle can operate itself within operational design limits. And what that means is if you're driving a car autonomously, and all of a sudden it sees a country dirt road that it's supposed to go over, it won't drive there because it doesn't know kind of what to do next. There's also the human driver can intervene. So there are some controls. We're starting to see things happen reasonably quickly. So Waymo's doing some level 4 testing in Arizona. They started that in October. Then we get into level 5. And level 5 is kind of the nirvana of autonomous cars. That's where the autonomous car can operate itself without a human driver under all roadway conditions. None yet. So when we say that there's going to be 10 million AVs on the road by 2020, that might mean that there's level 3, could be level 4, probably not level 5 yet. So if I'm taking a look at who's playing, almost everybody is developing autonomous driving capability. Waymo's the Google spinoff. If you lived in a couple major cities in the US, you'll see that Uber has been doing some autonomous driving tests. They're doing some stuff in Philadelphia. Intel just bought Mobileye, so they're getting into autonomous vehicles. I believe somebody said they owned a Tesla, so the Teslas, to a certain extent, have probably level 3 autonomous driving. The big car companies are getting into it. I didn't list everybody, but GM, Ford, Nissan is definitely getting into it. So is Toyota, so is a number of the other car manufacturers. And then, of course, Apple is also getting into it. So what's going to happen for sure is autonomous cars will be part of our lives. They'll probably show up in urban areas first because they're easier to navigate. There's going to be more people there. So that's where they'll show up first, probably less in the rural areas. So I'm going to move to the next screen, keeping in my 10 minutes. So how might autonomous cars change our lives? How would it apply to healthcare? Some of this is fairly intuitive, but if you think about aging in place, one of the things that a lot of times seniors would like to stay at home, and the barrier of staying at home is you can't get to transportation and you can't get to services. Now, I have to admit, that is changing a little bit now where you've got, Lyft and Uber are offering some of those services, but depending on where you are, those may not be available. When we start seeing autonomous cars, we're going to be able to change that quite a bit. And if you can stay in place, it turns out that people tend to stay healthier. The one below, disabled mobility. So I don't know if you saw I think it was the Waymo video where they have a blind person in a car. So you've got a number of cases where you are now enabling disabled people to have freedom to get to places that they need to get to. And again, that will lessen some of the need to be able to get to healthcare services. So it's going to be much easier for them. The middle one, when I was at Kaiser, we did something called Imagine Care Anywhere. And one of the things that we were looking at there is you could envision a autonomous car as urgent care that comes to you. So instead of calling an ambulance, you could actually have healthcare providers or other third parties have an autonomous car where you're feeling a pain and you could call the car to come next to you, and you could combine that with telemedicine and be able to do some additional things, as far as treatment, diagnosis, screening. So that's going to be a very interesting area that will also impact healthcare. Aging in place and reducing loneliness are fairly closely associated, but if you can't get around, and one of the stories that I would probably go through is when my mom was getting older, didn't really want her to drive very much. So, of course, unless you can get from one place, say to the senior center or to other areas where you can meet with people, you increase loneliness. So autonomous cars are going to increase that. One of the barriers that, although Lyft and Uber are addressing some of this, depending on the population, you may not necessarily trust a person to be driving you that you don't know, but you might be trusting the car more. And we've done some surveys when we were looking at the insurance perspective. So the trust of autonomous vehicles being safe is actually starting to go up. It's not quite there for everybody, but it is going up. Moving to the next thing, a number of accidents. So if you assume that something like, and this is a US figure, 94% of traffic accidents are caused by driver error. So if you have less problems with drivers, you're going to reduce the total number of accidents, which will probably change the dynamics of some of the emergency care resources that have to deal with traffic accidents and injuries from traffic. I think we're going to get into this a little bit later, but there are companies that are already getting into autonomous delivery of medications and medication supplies. The folks that are going to talk about drones a little bit later, they can deliver packages and do other things. The land delivering of packages is something that you're also going to see. So there's a company that's doing that. What's pictured here is, think of those as grocery sack size things that they can deliver. So part of the big impact of autonomous vehicles on healthcare is going to be able to enable people to stay and age in place, reducing the loneliness, giving people that don't have mobility, and getting a little more creative, taking a look at how can you bring healthcare to somebody without necessarily having to man it. So that's kind of my quick summary of autonomous vehicles and how it's going to change healthcare. I think the other thing that we don't really talk about too much is autonomous vehicles are actually going to change the urban landscape. So we've talked to some of the larger cities and city planners, and they're thinking, well, if I have autonomous cars, maybe I don't need parking spaces. So if I don't have parking spaces, maybe I can create more public areas for people to be in. So it's going to change some of the urban landscape, which has some benefits for healthcare, but not as direct. So that's kind of my quick 10-minute summary. Did I make it within my time, Gloria?
You sure did. Thank you so much.
All right, so
Brian.
Let's go to the next one. I stopped sharing so we can present.
Yes, absolutely. So next we have Janick, who will give us an overview of healthcare specific use cases. Right. And Janick, we can see your screen. You may be on mute.
Now can you hear me?
Yes, we can.
That's great. So I'm going to start. So my name is Janick Mischler. I'm responsible for the autonomous delivery program of Swiss Post, and that includes the delivery drones and also delivery robots project. Today I'm going to focus on the delivery drones, as we have announced the first real commercial application using drones together with a hospital group here in Switzerland approximately 1 year ago. So what have we been doing so far? We started our drone project about 2.5 years ago now. It was in July 2015. And actually it was a very funny story, because our management directors at Swiss Post decided that we should play around a little bit with drones, because everyone else seemed to be playing around with drones. I mean, everyone has probably seen the videos from Amazon or Google, and of course they are very impressive, and that was the reason why we decided to do something with drones. And that's why we received the first approval for beyond visual line of sight flights in July 2015. At this moment, nobody thought that there could be a real commercial application. But only 2 months later, in March 2017, we have started the testing of the first real application of drones in Lugano. That's a city with the same population density as San Francisco. And we have connected over there two hospitals who wants to transport blood samples between two buildings. And so far they have been using taxis, but of course this was very cumbersome, very costly, and it also took a lot of time. But I will return to this use case later. Also in fall 2017, we invested in Mothernet. Mothernet is a manufacturer from Silicon Valley we are collaborating with. So actually they are producing the drone. And I think this behavior is typical for Swiss Post. We always try out new things. We are implementing technical proof of concepts. Afterwards, we are looking for a business case, because we believe if we find someone who is willing to pay for a new application, for a new solution, then this solution is also going to scale. And that's the reason why we invested in Mothernet, and also why we believe that drones will leverage in the future. Since October 2017, we have been running the commercial service in Lugano. That means we have customers who are paying for transportations. And so far, I think we have been operating more than 300 deliveries using drones. And now this year, we are really aiming to scale drone networks, to establish drone networks all over Switzerland, also in very large and popular cities like Zurich, for example. And I think the goal is really to achieve the next step, the next stage. So as we are discussing about healthcare today, probably I'm going to focus on the use case that we have implemented in Lugano. Just to start, as I don't know your background, a few words about drones. So when we are talking about drones, we are always talking about transportation drones. That means drones that are able to transport a good from A to B autonomously. That means without the pilot. The drone we are using transports a payload up to 2 kilograms over a distance of up to 20 kilometers. That's approximately 12 miles. And with a flight speed up to 70 kilometers per hour. And of course, we had to include several security systems so that we can guarantee that even in case of a technical failure, the drone will not crash. Because of course, that's always what people are afraid of, that the drone is gonna crash, that someone's gonna injured, that someone's gonna hurt or whatever. But we have included several navigation systems, for example, like GPS, and in case that the GPS system is going to fail, we are just using the Russian GLONASS system. And we also have a parachute, so in the emergency case, we can use the parachute so that the drone is not crashing on the road. So what have we been doing in Lugano? We had a request approximately 2 years ago from the CEO of the hospital group in Lugano, and he told us that he has a big issue. He has 2 hospitals in the same city. The distance between the hospitals is only 1 kilometer, but there's a lot of traffic. And so far, when he had an emergency in the hospital Ospedale Italiano, that's a smaller hospital, then he had to call a taxi. The taxi arrived 15 or 20 minutes later at the emergency station to pick up the blood samples who were taken from the patient, and then the taxi driver had to drive through the whole city, through the traffic jams, to the other hospital, to the Civico, who has a blood lab. And so far, the whole process, the whole transportation has taken between 30 and 40 minutes in average. And now we have installed the drones, and using drones, it only takes 3 minutes to do exactly the same kind of transportation. So what we are transporting now, or what we are very proud of, is, I think in Lugano, it's the first time in human history that someone has been using self-flying, fully autonomous flying drones with an official approval from the Federal Office of Civil Aviation. So that was really the first time that we were able to establish a regular operation over a populated area, over an urban area. So just a few words about the regulations. In most of countries all over the world, including also United States, it's quite hard to get an approval for beyond visual line of sight flights, for autonomous flights using drones. And in Switzerland, we were very happy because the regulations really tried, or the authorities really tried to enable those cases using drones, especially because people believe that when we are using delivery drones for medical purpose, then we are helping hospitals, we are helping doctors to improve patients' treatment. And that's also why we have strictly focused on the medical industry, on healthcare, because we believe that people understand why we are doing that. If we would transport, for example, smartphones or coffee to the end customer, I think that would dramatically change the public perception of our delivery drone project. And that's one of many reasons why we have this focus on healthcare applications. So probably as a last slide, a few words about the customer value of drones. What is actually the advantage? Well, we have proven in Lugano that we can save up to 80% of the transportation time. In other words, the blood samples will arrive 80% faster in the blood lab, and therefore we can start the treatment of the patients also much quicker. Of course, that results in a better patient treatment. Furthermore, we have cost savings. Of course, it's much cheaper to use a drone who is flying for 3 minutes than using a taxi or a car. And not to be forgotten, it's also much more sustainable, because so far we had a taxi with a weight of 1,500 kilograms, and now we have a drone with a weight of 10 kilograms, doing exactly the same kind of transportation. And not to be forgotten, the higher availability. The drone is always available when the customer uses or needs the drones. And it's absolutely independent from traffic or road condition. The only influence that we might have is, of course, if there's heavy weather, if there's a storm, if there's a blizzard, if there are very, very cold temperatures, that are actually the only influences that could prevent the drone from flying. So that's it. This is a very quick briefing.
Thank you, Janick. Thank you. It's amazing to see what you and your team have done to go from what you called playing around to real applications, even in a commercial setting. I wonder how quick we will see the use of this technology spread into other geographical areas as well. Sometimes the future seems a long way off, but I'm sure the work you're doing contributes to that future coming sooner. Thanks for that. And from Switzerland, we are going to travel, not in a drone, but virtually to the other side of the world to talk about an initiative in South America, in Peru to be more precise. That is where our next speaker, Juan Bergelund, has started UAV del Peru back in 2005. And it currently leads the use and implementation of unmanned aircraft in emergency and disaster situations. I'm looking forward to hearing your stories, Juan. We are over halfway of this webinar. We'll have a bit of time for Q&A at the end of the session. If you come up with questions already, you can put them in the chat box for now. And with that, Juan, the floor is yours.
Yeah, good morning, or good afternoon, or good night. So yeah, this is Juan Bergelund from Peru. Actually, the risk of reducing my time, I will share with you a video that I have for the things that we did in the jungle of the Amazon in Peru. Actually, I wear two hats. I am the CEO of a company called UAV from Peru, that as the name states, you know, we are one of the leading providers of UAV services. But most important than one, we partner with, I think, one a significant organization, a worldwide organization called We Robotics, that they drive the utilization of drones all over the world. and we are very proud to be their local partner in Peru. They have several labs around the world, and we are Peru Flying Labs. So I will try to cover first with this small 2.5 minutes video, and then I have a PowerPoint presentation. Let me see if I can move this one ahead.
Communities in the Amazon rainforest face large logistical challenges in the transportation of essential supplies, such as medicine and blood samples, leading to inadequate or even non-existent healthcare. We Robotics, along with Peru Flying Labs, the Peruvian Ministry of Health, local doctors, and other partners, has been continuing to field test cargo drones in the Amazon to better understand their opportunities and limitations, and to develop streamlined workflows for regular deliveries in the area. In late June, the team headed to Pucallpa, Peru, and over the span of 2 weeks performed a total of 44 flights to nearby remote villages and clinics, carrying a variety of items, including medicine, lab tests, and common items such as food and money. Different routes, ranging up to 120 kilometers, were tested to demonstrate the medical use cases, workflows, and technical limits of the platforms. While the vast majority of the flights were successful, there were 3 technical failures, which were immediately investigated and fully documented. These tests were carried out primarily using commercially available drones, which have already been flown in dozens of countries for a wide variety of use cases. For the remaining flights, the team field tested 2 experimental platforms, including a hybrid vertical takeoff and landing drone. Ultimately, the field tests confirmed that there are a large number of factors that must be considered for cargo drone deliveries, such as regulatory restrictions, the nature of the cargo, the frequency of the flights, business sustainability, and budgetary constraints. In the case of Peru, the insights gained from the field tests demonstrated that an affordable cargo drone is needed, one that can be easily operated and locally repaired. We Robotics will continue working with platforms that meet these criteria, meanwhile proactively reaching out to companies who are developing promising cargo delivery solutions.
Now let me go to the presentation now. I have here. Okay, as I mentioned, we represent We Robotics, and we decided to do some testing of cargo drones in the Amazon, basically oriented to the health industry. This is where we are, in the middle of South America, and this is kind of the size that we are, how big or how small, related with the US. And the jungle, as you can see here from the picture, is very pretty, but as you can see, the rivers are not very straightforward. So as you can imagine, the challenges going from point A to point B are significant. Some places that take 6 hours, you need to go by a canoe. It will take, 30 minutes by air. So that's the main challenge that we are facing on this area. So we decide to do some testing and going from one way, taking anti-venom medicine, and the return way to taking blood samples. So you can see here the medicine we are taking from one way, because on this part of the world, the statistics are very sad. So they have 45 bites of snake per month. So that's a significant challenge that we have on this part of the world. One thing that we learned is community involvement is very, very significant, because as you can imagine, in this part of the world, there is a significant misunderstanding about all these new technologies. But if we explain to the community that we are here to help, especially on the health, we were very well received. And this is more of the same. We had to explain, day and night to the community of those things that we are doing. And then another thing, as you can see here, they are not fancy drones. Yeah, the reason is we are using low-cost drones because this is kind of you may call it the middle of nowhere. You cannot sustain, sending these Mark Zuckerberg big drone because, as we may know, the drones have issues. You may have small crashes. So we need to have a drone that the guy who repaired the motorcycles should be able to repair these drones. And the guy who studied 6 or 7 months IT should be able to drive this autopilot. So that's the main challenge. So using these low-cost drones, between $5,000 and $6,000 to deliver this medicine to the significant distances. We go to 20 kilometers, 40 kilometers, 70 kilometers, and our largest one was 120 kilometers with a combustion. And as my previous speaker were mentioned, in the comparison is if you take these fast boats going from one town to another one, we were able to go there in an hour using half gallon of gasoline, and then for the same boat to get there in 4 hours, it takes 55 gallons of fuel. So you're talking about a significant difference on pricing, especially if you are taking these critical cargo. These are the drones that that we were using. As you can see, they are not, too sophisticated, but they do the job. They were able to carry 1 kilo, 2 pounds of medicine from these 2 different cities, as I mentioned, between 20, 40, and 60 kilometers. And these are the exercise that we do with the town. And here is a little video that you can see how do we launch these drones. And the good thing is we are a soccer country, so we go from a soccer field A to soccer field B in 2 different towns. So we don't need any special runways to operate. And again, this is more of the same. This is the people waiting. They know it's a big event in the community, and they were very excited about seeing this technology, how they're going to help them. Again, from us, the perspective is going to be similar that has happened with the telecommunication with the phone industry. These people didn't have a phone at all, this fixed line phone, but everybody now has 1 or 2 cellular phones. Same thing with the air industry. Those guys, they don't have access to the regular planes, but they will have access to drones. So that's how we see it. And this is a volunteer from our organization to taking some blood samples to return on the flight to the original city. And then one other thing is we can fly day and night. So with this autopilot, as you know, the drones doesn't need to see where it's going. So that's another thing. Emergency didn't happen only a day, so it happened day and night. So with this kind of drones, we're able to use it day and night. And then, as I mentioned, we were discussing with the people. These are the people who repair motorcycles, and these are the people who need to repair the drone. So, and again, as I mentioned, the people who study 7, 8 months IT should be able to do and to handle the autopilot. These are the cities that we cover. Contamana, Tirun Town, 75 kilometers, and then another 55 kilometers to Pucallpa. And as you can see here, this is where we put the medicine on front of the planes. And this is the result. All the people involved were very happy that we're able to make it. So basically, that's all I have to say. And just the last word is, yes, as my previous speaker mentioned, you know, regulatory is a big issue because drones looks like a toy, sometimes cost like a toy, but they are not a toy. So we are working with regulatory people, and unfortunately, we don't have the same proactive thing as in Switzerland. Here, they are not, you know, for several, maybe I would like to think for lack of knowledge, they are not very proactive on helping us moving this technology in areas that they need it. But we are working hard, and hopefully they will see the light. So basically, that's all I have to say at this time, and thank you very much.
Thank you, Juan, for sharing those accomplishments. It's inspiring to hear yet another use case of this type of technology in the healthcare domain. You showed very convincingly that drones are a way more efficient mode of transportation, especially in the area that you have deployed it. I think it's exciting to see how these are being applied worldwide to improve health and care. Thanks again. We are going to turn to the audience now for questions. I guess people will have some questions. There's been some of activity in the chat box already. And if you do have a question too, you can unmute yourself now and ask our panelists yourself, or write it down in the chat box and we'll get it to them for you. Is there anyone that wants to start off? Or to get you guys started, I have a question for you, Brian. At Kaiser Permanente, you practiced with the Medicar you mentioned, and you said cars are being fitted with medical sensors.
So what I said is at Kaiser Permanente, we did a project called Imagine Care Anywhere. By the way, I think I've got the website for that, but you can take a look at it. And one of the concepts that we were thinking of is, wouldn't it be interesting to, in the future, when autonomous cars can get from one place to the other without a human, think of that as kind of a quick triage stage. And there's a nice video out on the website. So it's a concept, not something that we've actively done. In Garfield Center, we actually did show how that might work. But I think it's an interesting concept.
I agree. And you mentioned cars being fitted with medical sensors. Is this something you see happening at the big car manufacturers already today?
Well, you know, when you're looking at big car manufacturers, some of them are starting to do things that are more of the, I won't say medical sensor. They think of it more as kind of the Fitbit kind of thing, where they've added some stuff on seats, where you can get a haptic signal that says, oh, it looks like you're starting to fall asleep. And a lot of this stuff is really quite early. As you're starting to get sensor technologies becoming very inexpensive, so they're starting to add pieces of technology. Of course, the first pieces they're going to add are the ones that contribute to safety. Everybody now has backup cameras. You have the automated braking systems where they see something in front of you. But, you know, it's moving quickly.
Yes. Okay, cool. I know that in the Netherlands, some students have done projects where defibrillators have been mounted on drones to get it to patients faster than an ambulance would reach a patient. And I read about Swedish researchers having tried this out as well and showed that a drone could reach a patient much faster than an ambulance would. I guess this is a question for Janick, perhaps. Is this something you are looking into as well in doing? What other things could be moved faster than through the conventional ways? Or are you considering moving? And please unmute yourself before answering.
Can you hear me?
Yes, we can.
Okay, sorry for that. Well, actually, it's important to know that there are some regulatory issues, and one of those issues is that you have to do for every route you want to fly a risk assessment. And in average, that risk assessment is going to take between 3 and 6 months. So this is a disadvantage if you have an emergency, for example, and if you require flexible routes. And that's also why we have a very strict focus on fixed connections of fixed buildings. That means we are only doing delivery drone transportations on fixed routes. That means connecting hospitals, connecting blood labs, connecting different facilities. But so far it has not been possible to do flexible routes, and that's also a reason for which we are not intending to use drones in real emergencies. Not now, probably in 5 or 10 years. I think we have to achieve that the drones are integrated in the air traffic and in the air traffic management systems. And once we have achieved that, and once that we can ensure that a drone is able to fly safely, that means without a collision with a rescue helicopter or whatever, I think then we will be ready to implement cases, as you mentioned, as they have been testing in Netherlands.
Yeah, interesting. And in the chat, you mentioned as well that you have been testing self-driving buses for public transportation or self-driving robots for delivery. Can you share more about that?
Yeah, we have that are 2 different projects. Actually, one approach is in a city in Valais, in Sion, and over there we have been testing a shuttle bus that was driving through the old town like a normal bus. And this bus was self-driving, but only with a speed of 20 kilometers per hour. And I think it has been transporting now 200,000 people in the last 1 or 2 years. And yeah, it was a great success. But nevertheless, I think when we are talking about autonomous driving cars, we should absolutely understand that we are still in its infancy. Because it's I would say I really like the picture that you showed at the beginning with the levels of autonomy of cars, and I think it's quite easy to get from step 1 or level 1 to level 3, and then it will become extremely difficult to get from level 3 to level 4, and it will become much more difficult to get from level 4 to level 5. And that was also our learning from the tests in Sion. Actually, people and customers really like this self-driving bus. And to be honest, it's one of the most popular tourist attraction in this area now, because every tourist is making a ride with this shuttle bus. But nevertheless, I mean, it's in a very artificial environment. I mean, it's on a safe route, and the route is predefined. And the maximum speed is only 20 kilometers, and so yeah. And delivery robots, we have been testing delivery robots also with healthcare use cases. For example, we have been transporting drugs from pharmacy stores to the patient's home when they were ill. And actually that was really a success story, because the pharmacy manager wanted to keep the robot. Unfortunately, we had to take it away again, because we only had a special approval that allowed us to operate the robots for 3 or 4 months.
All right, interesting. I live in the city of Eindhoven in the Netherlands, and there is a piece of highway that is used by the general public, but it's also considered a test track for testing trucks, autonomous driving trucks. So you might see them when you drive there.
We're seeing autonomous trucks in the U.S. also, but it tends to be more from what we call freeway or highway driving, and a driver tends to take over on the off-ramp and on-ramps. But that's happening. We've also seen drone trucks where somebody is driving the truck remotely. So we're starting to get there too, and I would agree. Most of the autonomous is pretty early, but if you see the speed that things are happening, my guess is, 5 years or so, it's going to be much better. And you're right, getting to level 5 is very difficult.
But one insight that is probably very important that is not very obvious. I mean, we have been operating the delivery robots completely autonomously from an external point of view. But what I believe what will be, or what will really enable autonomous driving in a midterm are vehicles that are able to drive autonomously in 99% of the cases. For example, our delivery robot, in 99% of the cases, it was able to drive autonomously. That means it recognizes traffic lights. It's able to cross the road. But if something happens that is unexpected, like an accident, like a construction areas, or even children that are playing with the robot, then you need the interaction of a human who is probably sitting in a remote control center, who is giving commands to the robot, how the robot should deal with a specific situation. And I think that is what is enabling at least level 4, and probably also, it's level 4, I mean, that there is a human who can interact whenever you require additional support.
Yeah, we're seeing that. Nissan is actually exploring that with NASA. You can see some articles out on the internet. But that's their thought also, where you can handle 90% of the situations, and when it can't figure out what to do, the human remote driver can figure out what the right thing to do is. And Nissan's doing some work on that.
There's a question from the audience in the chat box. Michelle is asking, what would be the biggest barrier to having drones individually transport humans in the future? What do you think?
So is that drones or cars? In other words, is it flying or is it on a road?
I guess we'll see both.
On the road, I think it's going to be easier because there's less regulations to worry about.
And when they're flying?
To be honest, we have already evaluated exactly this use case here in Switzerland. And there are several problems. Problem one is the regulatory problem, but this is only a problem that is valid probably in the next 2 or 3 years. Then you will have a solution. But there are other problems or constraints. For example, technically, I mean, when you want to fly around a person who has a weight of, let's say, 80 or 90 kilograms, then you need a drone that looks pretty much the same as a helicopter. And then we are talking about helicopters. And when we are talking about helicopters, then we are talking about a transportation method that is very popular and very common, I would say, since 60 or 70 years. But on the other hand, it's very expensive. And that's why normally people are traveling by bus or subway and not using a helicopter. Mm-hmm. And I think this is also one of the this is also one challenge why people will not use drones to fly around, at least not in a midterm. Mm-hmm. And not to be forgotten, when you have a drone, our drone that we are using today is 10 kilograms. That's 20 pounds more or less. And when you have a crash with such kind of drone, it's not very dangerous for the people who are walking around, because normally they can escape. It's enough if you just make a few steps and then you will miss the drone, or the crashing drone will miss you. Mm-hmm. But if you have a drone that is transporting humans, then you will have a drone with a weight of probably 200 or 300 kilograms. And then, of course, the situation is completely different, because then you will have a small car crashing on the road.
Yeah, I would agree with that. And I think the other thing that, if it's in the air, we have to find roadways on the ground, and we already know kind of what that system is. We haven't, aside from regulations, we have to figure out what is the correct traffic patterns, and how do we look at traffic, and how do we manage it. And I don't think well, of course, that's part of the regulatory challenge.
Yes, I agree. So one final round, maybe starting with Juan. What would be one takeaway or word of wisdom for those that are testing or considering autonomous transport? What do you think, Juan?
Well, basically, as I mentioned, the regulatory part is a significant one, and at least on this part of the world. And the second, we need to consider that this is a kind of a very state of the art, meaning by that is there will be issues, there will be incidents on this technology, and we have to be careful on that one. Because, these $1,000 drones, we are talking about $20 or $30 engines, especially on the rotor codes, and then they're going up and down on the floor and 3,000 or 4,000 RPM on the air. Something will happen with time. So we just have to be careful on that one. And basically, that will be the word of caution there, Roy.
Thanks. Janick, do you have a takeaway?
I would say our main finding was never ask a customer whether he needs drones or not. Because when we asked people 2 years ago, hospitals, blood labs, do you need drones? Do you see any applications? They always started laughing. And now since March 2017, when we have proven that it is working, I think people are starting to take it more and more seriously. But it's as Henry Ford already said, if we had asked people what they need, the answer would have been horses or faster horses and not the car. And I think it's the same with all new technologies. People don't understand what its impact will be. They probably even underestimate it. But I'm pretty sure in the mid or in the long term, those autonomous technologies will completely change how we live and how the economies are working.
Yeah, you've opened eyes, right? So finally, Brian, do you have a magic trick for those considering autonomous transport?
I don't know that it's a magic trick, but I would say that autonomous vehicles are coming far sooner than you think. And you need to start thinking now, how might you use them? And I think the easier use cases, which are going to be very early, are being able to get people that have challenges getting to healthcare and getting to services. It's going to remove those barriers. So start thinking now how you can use autonomous vehicles. They are going to change the way we look at urban environment first. Rural is going to come much slower. So that's my words of wisdom. Start thinking now.
Great. Thank you so much. We are coming up at the top of the hour. So I want to take a moment to thank our wonderful panel this morning or evening, depending on where you are. Brian, Janick, and Juan, thank you so much for spending your time with us on this beautiful Tuesday. And with that, I'm going to hand things back to Cynthia to wrap us up.
Thank you, Jules, and thank you for moderating for us today. As a reminder, today's session was recorded and will be available on our member site, so please check out members.iln.org. I also want to share some information on our upcoming sessions. Our next virtual programming session will take place on Thursday. It's part 2 of our clinician burnout series, How to Assess Burnout. And on February 27th, we have an ILN Tech Tuesday, Democratizing AI, How Machinify Enables the Broader Use of AI and ML in the Healthcare Industry. Thank you, everyone, for joining us today. Have a wonderful Tuesday.